So Faye Johnson, as you've heard, is the Chief Executive Officer of the Northeast Florida Healthy Start Coalition, which was organized in 1991 as part of a statewide network of community-based organizations to provide care coordination to reduce Florida's high infant mortality and improve the lives of women before, during, and after pregnancy. Faye received her MBA from Edward Waters University and a Bachelor of Science in Social Science with a minor in sociology from Jacksonville University. She has an extensive background that ensures a level of competency in preconception health, maternal and child health, health equity and equality, life course model, racial health disparities, and the social determinants of health, as well as administration and quality assurance. Faye has been recognized with several awards, including as a finalist for the 2017 Florida Times Union Eve Award, the 2019 Jacksonville Business Journal Women of Influence Award, and the Florida Department of Children and Families Child Welfare Excellence Award. Faye served as the president of the statewide Florida Association of Healthy Start Coalitions. She has 25 years' experience working with underserved populations and in administration and management. Faye views her service opportunities as an experience that she values and is humbled every day by the opportunity to serve others. Please join me in welcoming Faye Johnson to our pulpit.
Wow, I am truly humble to be here. I mean, I was just sitting here thinking and listening to the music and just the love that you feel across here, and I'm not just saying that. In my daily walk, in the work that I do through the Northeast Florida Healthy Start Coalition, and just in my daily walk, there's so much that you see. And through my life, and I will tell you just the beginning of my life, I was born to a mother who in the 50s and 60s was becoming an educator, if you know what that looked like back then, trying to become an educator. Things when you weren't allowed to read, things when you were told you couldn't. And then I was born to a father with a 6th grade education who worked 2 full-time jobs all his life. His work ethic was strong. He retired 30 years from both. And then my grandmother, and all her grandchildren, but especially her girls, for some reason, she made sure that we held our heads up. She made sure that we looked folks in the eyes and not drop our heads. So I came up being maybe a little rebellious. No, let me stop. But just knowing that and what she instilled in us was that you're somebody. From the day you're born, my mom would say, if you're a ditch digger, you be the best. No matter what it is, you're somebody. And that meant a lot. So in this walk of my work, it takes me down a journey starting back in, I think, 1990 when my husband was in the military. We were in the military and stationed in Texas. And I started to work with populations which I understood because I, too, still I rise. So I understood that. And in working with the populations that we serve, vulnerable populations across the country, across the United States as we travel, I thought way a long time ago that I was going to go in this job in the corporate world and I wanted to make a whole lot of money, right? That wasn't where God led me. Every time we got stationed, he always sent me back to serving others, serving others. So at one point I said, well, you know, Lord, you're guiding me, let me be obedient. Let me do what you want me to do. And the money will come if it's to come. If it doesn't, it doesn't. But my heart will be filled because I'm serving others. And I understand vulnerable populations. Even though it was tough, you know, when we were growing up and everything, but we knew we were loved. So just being loved paved that way. And so many of our populations don't feel the love right now, haven't felt it in the past, definitely not feeling it now. You know, so we have to be in that space, and that is what the Northeast Florida Healthy Start Coalition does. We have several programs that, as you've heard. I started with the coalition in 2001, I believe, and I've been the CEO since 2016. And we've grown our programs because we see the need, we see the love that's needed, we see the support that's needed. We have several programs that you all heard. Some of our programs, especially our federal Healthy Start program, the Magnolia Project, is there to eliminate perinatal disparities in birth outcomes and racial disparities. So we work very hard with the populations in that particular group to make sure that all babies deserve a chance at life and deserve a chance to live to their first birthday, if that's what the mother, we work on that. So in that space, we also have other programs such as the Azalea Project, which is a substance abuse prevention program for pregnant women that are using drugs. And then we have other programs, our Fatherhood PRIDE, as you've heard, Nurse Family Partnership, our State Healthy Start program. We're one of the only organizations here that is funded for both federal and state Healthy Start. And those are home visiting programs that go into the homes and really work with families around not just health issues, but the social determinants of health. Because that's what's driving a lot of the maternal deaths that we see, a lot of the infant mortality that we see, and also some systems issues. And I won't go into that this morning, but some of you all understand what I'm saying. So with systems and access to barriers that are preventing folks from receiving the care that they really need, or the health care that they really need, or just social services that they really need. There are certain barriers that present this. So we're there every day. I have an awesome team that's in 5 counties, and we go out and try to make sure that the folks that have been marginalized, so to speak, have the support that they need, that are vulnerable, have the support that they need, not only the mothers, the fathers, and the babies. Because one of my responsibilities with the team that we have at the Northeast Florida Healthy Start Coalition is that every month we review the death records of the babies that did not live to their first birthday. That's something I carry every month in my team. And we do that so we can look at some of the preventable things that could have been done. We look at the social determinants of health, the life course. What were the barriers? Were the insurance barrier? Were there this thing? What else would we have done for this family to ensure that that baby made it to its first birthday? And as you said, there's still work to be done, but we have seen some decrease in those areas, but there's still so much work to be done, because when you think about maternal mortality and infant mortality, there's so many factors and variables and things that impact that. So you have to look past just the health of the mother and the baby. You have to also look at those as social determinants of wealth. And those are where people live, work, play, and in some cases even pray. You know, you look at all those things. So in our work, as we walk across this walk, I wouldn't be doing anything else in my life. This is it for me. This is where I want to be. This is where I should be. And I tell my team members, those that come before, because we have many subcontractors and we have a lot of folks that work out in the community with our families. I can train you to do this job, but I can't train your heart. You know, there's something about this work that your heart has to be in the right place. Your mind must be in the right place. You make sure that these are the families you truly, truly are trying to support, trying to help, and trying to educate. And the way I look at that is that if not for the grace of God, there go I. And I know that to be true. Because many of us have had challenges in our lives, and you went back and it wasn't all perfect and everything, and you tried to push forward. Many of the populations that we work with and we serve, they just need somebody to say, you can do it. You know, you have the support. Let me take your hand. Let me take you down this journey. Yes, it's going to be hard at times, but still, you can rise. You can rise. And if you all know Maya Angelou's poem, Still I Rise, you understand where I'm coming from. You know, there's so much hope in our families. When you look at the little babies and you look at the girls and the boys across the board, no matter what race, there's hope. And as long as they have some hope and they know that there's somebody, I don't care if that morning if you got up and the lights were turned off, we're going to figure out how to get the lights turned back on. If you don't have any food today, we got a team out there. We're going to try to make sure that you have that food, not just for today, but tomorrow. So how do we do that as an organization with the challenges that certain organizations and nonprofits face today? We collaborate heavily with other organizations. We make sure we know what the status is at that time when we're trying to make certain decisions and strategic decisions, you know, as we move forward. We ensure that we have our partners and our think tank around the table. As Penny mentioned, we have a maternal and child health policy and research center. So we do a lot of research in this area, and also with the center, then we're able to really track the different policies. And that's very, very important, to know where we are and what policies are changing, what bills are passing, what bills are not passing, so that we can prepare our people for what is to come, or what is, and we do it in a very respectful way, making sure that we're in guidelines, but making sure that people are taken care of. You have to look at diversifying funding so that, you're able to give food to those that you may not be able to use this type of funding for. But we still are going to support. If they come to the door, if they don't come to the door, we have community health workers that go out and find our women and bring them in, or find our women and our families that don't have it. They go out in the community. They're considered the boots on the ground. They're out in evenings, they're out at night, in the afternoons, making sure that folks know these services are here. We want to support you, we're going to support you, and more importantly, we want to help you to improve your health status, make sure you get into care. There has to be a way. We can't just say, because of the barriers that be in place, we're just, oh, well, we can't do anything. We're just going to leave them out. Can't do that. I can't, Now, granted, we have a responsibility to make sure the doors of the Northeast Florida Healthy Start Coalition remain open, and I will do that. But at the same time, I have a responsibility to support, to help, because that's what I'm called to do, and I won't do anything less than that. So we go forth in many, many different ways. Like I said, we cover 5 counties, so not only Duval, Nassau, Baker, St. John's, and Clay are also our counties as well that we serve in our Healthy Start program. So we support those areas as well. I speak at various conferences so we can get our message out. We're on a lot of different boards so that we have partnerships and collaboration through the Maternal and Child Health Division. And it's amazing to see what can happen with a family if they have just some support. And I just believe in that. When you go out and you reach out, and when you see these families, they're struggling. And the women will tell you, it's one thing that we do that I require in this work. We don't do anything or any policy unless the community vets that policy and that work. Don't do for them without them. Because if you do, we think we have, oh yeah, I thought way back in the day I had all the answers, right? I put all these pretty things out there in the pictures, and they were like, Miss Lady, we don't want that in our community. And then as we started to listen to them and listen, their voice was very important. So in anything you do, always have the community's voice at the table, because they have a voice. And you say marginalized, vulnerable, if you're going to do that to them too, you victimize them as well, and we don't want to do that. So they come to the table, they tell us, what's happening today, what's going on. Even in the fetal and infant mortality review process that I talked about, or reviewing the death records every month, we ask moms or dads if they would like to tell their story. Because when you read it in the record, it's one way. But when you tell their story, you realize there were some other things that occurred. And so we also capture the maternal interviews of the mothers, and if the fathers want to interview, to get that other information that's not coming through in the records, and so we do that. And they tell us, and I remember one lady, she said, I'm just tired. I just want to be able to breathe. That says a lot. We think it's simple, but it's not. Just so much. She said, I just feel like I'm suffocating. I just can't breathe. If I could just breathe. And what she's talking about is from the stress and from the risk factors and all the trauma and everything that's happening in the community. If I can just breathe. And well, some people may take that as a different way, but when you think about it, if you can't get any air ever, every day, there's something pressing down on you every day through your whole life course, even as a child on up to an adult. Because preconception health and the stress that occurs during the life course affects the health of the mother down the road before she becomes pregnant. In many cases in our records, we see where moms, some of them have hypertension, diabetes, and obesity coming into the pregnancy. And so that's a lot on a mom and a newborn baby, or a baby to carry, and think we're going to be able to make sure that baby is born healthy. So how do we address those things going upstream? How do we look at that? By the time she becomes pregnant, her body has already been impacted by trauma, life circumstances, the life course, And so we also work with our moms before they get pregnant in the event they choose to be or not to be. You know, we work with them around those areas, getting them to understand that. So this work for me is a life journey, and I want to thank Dr. Harmon so much for inviting me here with you all today. If there's any resource or any information that we can provide or data for you, Penny, we can also send that as well. But I want you all to know, just sitting here this morning, it's many families that don't have the view, that's this beautiful view like you all have. And I was sitting there, I could stay here all day. Just let me just sit and just right here. I don't even want to move. But, you know, I know I got to. But, you know, I'm just thinking, you know, many don't wake up to the birds singing in the morning. They don't wake up to those type of things and the peace. So we have to find a way how to give them that peace, even though we can't move them into, move them into a new apartment today or anything like that. But how do we help those families find peace and joy? We have to. We have to. If we're about this work, we have to. Diversity is real. We need to include everybody. Everybody needs a equal hand. Equity is real. You know, so how do we work on those imbalances? How do we do that as a people? What can we do? You know, and I just, like I said, it's encouraging to come before you all this morning. It's encouraging to be here. I do this every day, and I wouldn't give anything on this earth for anything to be able to do this work, because I believe, like I said, still I rise in spite of it all, and if not for the grace, there go I. So thank you all so much for having me. Thank you so much.